Good morning, Dan and Amy. Returning to the topic of COVID 19 generally, one of the under discussed aspects of the Trump administration policy and personnel was in the area of mental health. And this is writ large. It's not specifically or exclusively to COVID 19, but it certainly includes those who have been adversely impacted in terms of their mental health because of lockdown policies and so forth. Interesting piece by Sally Satelm in National Review about the Trump administration's mental health reforms, which I don't think have gotten much discussion really at all. Dr. Sally Satelm is a resident scholar at the American Enterprise Institute and a visiting professor of psychiatry at the Columbia University Vagelos School of Medicine. Dr. Satelm, thanks so much for joining us again. Appreciate it.
Thank you.
Could detail some of those mental health advances that were affected under President Trump?
Yes, this is through an agency that not many people have heard of. It's part of HHS, and the specific agency is called the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. And it's been around since 1992, but under President Trump was the first time it actually had a psychiatrist as its director, which says a lot. I mean, you would think that an agency devoted to people with mental illness and addiction would have a doctor in charge, and this was the first time it did. And and her name was Dr. Eleanor McCants-Katz. And what she did was pay much overdue attention to three main problems when it comes to people with mental illness. And I'm really talking about severe mental illness, schizophrenia, bipolar illness, very severe depression. One is that there were not enough inpatient beds. So if you went to a hospital, you might wait in the emergency room for up to a week and then be discharged often before you're ready. Second, the number of people who are with mental illness who are in jails and prisons, overcrowding those institutions when they should be getting help instead. And the third is that so many people with severe illness, they fall through the cracks. You know, they need so much assistance, and going from one agency to another, it doesn't work that well. So what she did was develop a number of programs and strengthen others that helped people in those populations.
But as that pertains to COVID-19, I mean, there is a lot of research that suggests being without work increases the risk factor for clinical depression, in addition to anxiety, suicide, substance abuse, premature death. So does isolation and loneliness lead to worsening mental conditions. And so there is a nexus here with COVID-19 policy.
Oh, yes, there is. To be fair, what you're talking about is a very significant but acute problem with the mental health in the nation. And to be fair, there's a fair amount of public money going to helplines and going to therapy and funding telehealth, because a lot of people can't come in to see a doctor. And so I think in the relative emergency sense, there was and would have been, no matter who was the president, a fair amount of help going to these folks. Now, for so many of them, unfortunately, the real help is economic rejuvenation for so many. But as you say, the isolation and the deaths that many will encounter, and people in their families, maybe themselves being ill and having long COVID, as it's called, with residual problems, all definitely leads to stress and to development of depression and anxiety and suicidality, and an increase in substance abuse, especially for people who were struggling with those problems before. So that's true. What was so innovative, though, about the Trump administration in this specific regard, and why we wrote the article, I wrote it with Dr. Fuller-Torrey, is because these were long-standing problems of not paying enough attention to people who were in the system for years because they have chronic illnesses, and which is somewhat different from the COVID situation, which is more acute and more time limited. But they're both serious problems.
And so,
what are you What is the Biden administration going to roll this back? Is that what you're fearful of?
Well, we do worry, and the reason that what we worry about, and I can just mention a few of the programs that were strengthened or established under Dr. McCann's CAT, is that one of the things she did that was so important was kind of rebalance the agency's portfolio, because it had been really very weak when it came to paying attention to people with the severe illnesses that I mentioned before, schizophrenia, bipolar, the people who are homeless, the people who, as I say, end up in jails and prisons. And sometimes when they're unmedicated, can be involved in violence, and are often, more often than the perpetrators of violence, are often attacked because they're so helpless. And yes, it's that rebalancing that my colleague and I are afraid may be undone, because one of the efforts of this agency in the past had been what we felt was just a very unwise emphasis on, I'm going to say the phrase, civil liberties. And what I mean by that is the idea that if you are a psychotic person, I was just listening to the news before, the weather. I mean, I'm unbearably cold there. Someone who's psychotic and too paranoid to get help, out in the cold, literally freezing to death. This notion that that's their right is, absurd when someone is psychotic. We call it dying with their rights on. And unfortunately, the philosophy of this agency in the past had been very sympathetic towards that kind of policy, which is not to intervene when people are clearly, too mentally ill to protect their own interests. And so we're afraid it might go back to, funding kind of conferences that it did in the past, conferences that actually invited speakers who would tell patients not to take their medication. They fund what are called they fund legal services to get people out of psychiatric hospitals. Now, of course, everyone should have their right if they feel that they are being detained, unfairly and justly, and that they're competent. Of course, they should have counsel. But and this is a whole separate problem within mental health. The adversarial system doesn't work very well. So if you have a patient who's very psychotic, but a good lawyer, he could actually get someone out of a facility. And in fact, one of the most dramatic examples of this was a young man who was effectively sprung from a state psychiatric hospital in Maine. He was wildly psychotic. The father and many of the staff of physicians and nurses in the hospital were against his release, but the lawyers prevailed, and a few weeks later he killed his mother, which is dramatic. But it's not isolated. There are many situations where people are released from these facilities and either can't take care of themselves or occasionally commit a horrible crime like this. And this is because of a philosophy that doesn't embrace the fact that there are some people, tragically, who just need a kind of paternalism until they can get better.
And this is similar to the story of individuals, particularly as they age out of the system with severe developmental disabilities, physical and intellectual disabilities, in the sense that you have a federal footprint and you have a state and local footprint. And it seems to me what you're indicating is the direction the federal agency takes informs how state and local agencies approach the problem as well, and approach the treatment of these individuals. And so, it can have a positive effect for doing it right, and that provides some leadership at the state and local level, or it can have a negative effect because you have a bit of follow the leader, because you're following where the money is flowing to from the federal to state and local.
Yes, exactly. I was going to add that last part, which is key. It's not just the philosophy, which you're right, it has in and of itself has an influence But it's the fact that these states depend on the block grants that come from this agency to run their departments of mental health and provide services. So right, even though it's a relatively small agency, and in fact, the part of the agency, SAMHSA, that I mentioned before, that has control over mental illness is only $1.5 billion, which is relatively nothing on a federal level. But because, as you say, because it sets the tone and because it supplies the money and it also provides guidance on certain treatments, some of which are less science-based than others, another thing that Dr. McCants-Katz tried to change, they have disproportionate impact.
And you're talking about, I mean, give us a sense of the scope of the population we're talking about, too. Not just those that are have a chronic mental illness, as you were describing, but also those, who have a chronic mental illness such that, family cannot take care of them. The needs are just too great.
That's between about 3 to 5% of people between, again, the two major psychotic illnesses are chronic psychotic illnesses are schizophrenia and bipolar. So that's about the number for those. But they represent about 15% of state prison inmates and 20% of jail inmates. And in fact, Cook County is considered the largest mental facility in Chicago. And same with Rikers and the same with LA County Jail. It has more psychiatric patients in it than any of the states, than any of the facilities in those states. So.
And in terms of just how that's counted, I'm always a bit I don't want to say suspicious of government stats, but I'll say suspicious of government stats anyway. That is not people self-identifying. These are people who have been clinically diagnosed. They're not doing that to try to reduce their sentence or to try to get out of prison and into a mental facility. This is people who've been medically diagnosed by a professional such as yourself as having this chronic mental illness.
Yeah, and you're wise to be skeptical, but I have a lot of confidence in that, especially because it's also these are also data that are disseminated by a group called the Treatment Advocacy Center, which is private. It's in Arlington, Virginia, and they're devoted to the care of the severely mentally ill. And some people would say that advocates like to expand, inflate the number of people who need them, but actually sometimes you can dilute the effect when you do that. So those are reliable numbers, and in fact, in some of these facilities, it can be, up to 50% at some point. And again, we're right. We're not talking about depression. I mean, almost anybody in a jail setting is acutely depressed and anxious. There are horrible environments. And often there's so much additional drug use on top of, on top of one's, mood or anxiety problem that, it just, and people are going through withdrawal in jail. So there are a lot of reasons to get even bigger numbers, but we're just limiting it to those with these chronic illnesses. It's about a fifth of jail inmates.
Dr. Sally Satelm, resident scholar at the American Enterprise Institute, visiting professor of psychiatry at the Columbia University Vagelos School of Medicine. A really interesting piece about mental health in America. Thanks for joining us, Dr. Satelm. Appreciate it.
Thank you.
Thank you. And she joined us on our turnkey.pro answer line.
Connect with Dan and Amy using the AM560 mobile app. Download it today at 560theanswer.com/mobile.
A previous survey on AutoMD.com stated that only 16% of consumers have a positive view of auto repair shop experiences. We find this unacceptable. Hi, I'm Doug McAllister, owner of Douglas Automotive, and we're the shop your neighbors trust. If you hate being overcharged or feel your auto mechanic isn't properly trained on maintaining your type of vehicle, then you need to visit any one of our 3 Douglas Automotive shops. We've been offering the very best in automotive maintenance and repair for close to 30 years. Backed by our 3-year, 36,000-mile warranty on parts and labor. At Douglas Automotive, you're in control and know exactly what is being done with no surprises. See for yourself. Visit douglasautomotive.com or visit our Facebook page where you can read all our outstanding